Thanks for staying with us, and we move on to our second angle where we focus on the pace with which the vaccination is being conducted. And I talk about this, viewers, because things post 1st April have changed. Before 1st April, from 1st March to 1st April, we were vaccinating healthcare workers, frontline workers, and then those above the age of 45 with comorbidities or all above the age of 60. But starting 1st April, that changed dramatically when we said everybody above the age of 45 can now go and get themselves vaccinated. And if you really look deep into the data, it will tell you the story that the change and the higher demand for vaccines and the whole conversation and debate about shortage actually began post 1st April. It will also show you, if you track the data on an average, how much vaccination was being done every week, starting from second week of April, second week of March, to the first week of April, April 1 to April 7. You will see the numbers go up dramatically, doubling in 3 weeks. Obviously, because a lot more people are now eligible. Obviously, because we've stepped up on our vaccination centers as well. So there are more centers present, there are more people available, more doses were sent, and more people eligible. Now, is that really why we are seeing this sudden change? And if so, did we miscalculate what we would need starting April 1st? When we said above 45 everybody, when we said we will vaccinate 40 to 50 lakh people every day in this country, did we miscalculate how many doses we would need and how many we were manufacturing? That's the plain simple question that I have for our experts today. So let's say good evening to those who are joining us. Rajib Dasgupta, chairperson for the Center of Social Medicine and Community Health at JNU, joins me this evening. Dr. T.P. Lahane, Director of Medical Education and Research in Maharashtra, also with me this evening. Mr. Murli Neelakantan, lawyer specializing in healthcare law and former Global General Counsel of CIPLA in Glenmark. And I also have Vikas Dandekar joining me this evening, Editor for Pharma and Healthcare at ET Prime. Vikas, I want to start off with you. Would this be a fair analysis of the numbers that we are looking at nationally and in worst hit states like Maharashtra and Chhattisgarh? They stepped up their vaccination so fast that the math went out of the window.
Yes, it cannot be summed up better. As you rightly pointed out at the start of the show, initially things appeared pretty comfortable, but as the surge was not really predicted by anyone, I think that's where things went a little haywire. And now we see a situation very, very dramatically different from what we saw in the first week of March. And as you rightly put, it probably was completely miscalculated on exactly how things will move. And with the surge itself not showing any signs of waning, I think people are also coming out and in big numbers, and that's been the vital element of where things went wrong. So as you also pointed out, a mix of other missteps probably contributed to this complex situation, but I think now we should look at how to come out of this production problem, because from all the calculations, it doesn't appear that the ramp up is going to happen so soon. So yeah, it's a genuinely a very, very complex issue for the policymakers.
Because before I go to our other experts, the health minister yesterday said we have 4.5 crore doses in the pipeline. Now, the center seems to suggest that that is a good thing, where we tell ourselves that, look, there is no shortage, there are 4.5 crore doses in the pipeline. But even if I say that we get another 6 crore for serum this month, is that really enough to continue with our 50 lakhs shots per day number? I mean, how can our authorities not be looking at this number and saying, oh, we don't have enough?
No, the mathematics is very clear. I mean, if we add up all the capacity, we come to around 60-65 million a month of dose, of which the maximum weightage is in favor of Serum Institute. Because of the complexity of manufacturing the Bharat Biotech vaccine, the ramp up is going to be really slow. We don't even know whether the same level of BSL-3 facilities will be available elsewhere. So, divided by the kind of population that we are feeding in, definitely. I mean, it's not going to be possible to match up the demand and supply. There is nothing complex about it. It's very, very simple.
Okay. In fact, Maharashtra in the week March 11 to 17 did about 1,86,000 vaccination shots. Now, starting April 1st, when we opened it up to more people, and by then we had also built our additional vaccine sites, this number was averaging at 3,64,000. Similarly for Chhattisgarh and similarly for Odisha, 3 of the states who are now saying they don't have enough doses, they need more doses now. So, Mr. Dasgupta, I'm just trying to understand, is it that the states actually went overboard with their preparation and saying, oh, just let's vaccinate as many people as we can, or was this the plan all along? Then why are we here?
No, I think one factor we are not taking into account, or at least not overtly, is the push to open up more and more centers. So now actually we have 65,000 plus centers, which actually means 65 lakh vaccines per day, potentially, whereas the uptake now is an average of about 35 lakhs per day, average. But then this is in contrast to an average of 25 lakhs per day, which was a fortnight ago. But then remember that the number of centers were also relatively less. Second, the demand across rural India is also rising. It's not that this is only an urban picture. Of course, the maximum demand is in the urban areas. It also overlapped with the surge, as we were discussing. But the key issue is opening up to the 45-year age group, and that seems to have somewhat skewed the demand-supply situation. There is also the fact that states are now arguing for opening up further, which is certainly not possible at this point, not just going by the demand-supply situation, but also because India is following a certain prioritization strategy. The key point is that the next few weeks, if not a couple of months, is certainly going to be a very tightrope walk. Now, based on the Ministry of Health data, one analysis put the national average at about 6 days and the stock in the pipeline at about 12 days. But remember, in terms of the population covered, percentage population covered, the states vary widely from a minimum of 3% in Manipur to 17% in Tripura. I'm leaving out Ladakh, which is about 50%, which is a very small population. Whereas Chhattisgarh, since we're talking of Chhattisgarh, that's at a high of about 10%, which is one of the highest. Rajasthan, a very, very geographically challenging state, yet 9% of the population covered. Maharashtra is about 6%. So states have indeed been making an effort, and that's something to be proud of.
Yes. In fact, Mr. Dasgupta, Maharashtra just recently was praised by the center for the very good pace of vaccination that they were showing. And it was the advisors and the experts across the country who kept telling us that we must open more centers, we must make our centers 24/7, so it's easy for people to come and get themselves vaccinated. We must double up our speed, and everybody told us that they are targeting, and these are the experts who are working together with the government, all the advisors who are there. They're targeting 50 lakh vaccination shots every day. And I'm now just wondering, if that was the target, where are the doses? So let's now talk constructively. What can be done about it? That's obviously the other thing we look at. There are various options, Mr. Murali Neelakantan, about how do we now bring in more vaccines into the system, because the current arrangement isn't going to help us. Either we slow down or we find an alternative. Now, can we ask these vaccine makers, Serum or Bharat Biotech, to partner with other manufacturing facilities to ramp up production faster? Is that something that can be looked at?
Actually, this was what I had hoped the government would have done last year. Unfortunately, it's not something that you can just turn a tap on and add capacity. These need to be planned lots of time in advance. We had 1 year to plan for it. So what we could have done is planned for it better. The government has legal provisions which it can use, both under the Drugs Act as well as the Epidemic Diseases Act, to get manufacturers to contribute capacity to it. So if we knew what vaccines were coming through and we were approving, there is a chronology to it, we could have used existing capacity to focus on what was coming on tap first while the others were being developed. What the situation today is that all the vaccine makers who have any capacity have already tied up capacities for other vaccines. So there is no more capacity that you can now quickly get on tap, online for Covishield. Few of the others have tied up with Sputnik, few have tied up Cadila, there are Janssen's tied up, Johnson & Johnson vaccines tied up. So all of this should have been planned last year. Unfortunately, you can't just ramp up vaccine capacity. You can't build it in days or weeks. We're talking many months to be able to increase capacity. So,
but could it have been something,
Murli,
that the government could have looked into and intervened? Or do we say that this is a private space, it's up to the vaccine makers and manufacturing facilities to figure it out for themselves?
No, the government should have done it. And as I said, the government had powers under legislation to be able to effectively commandeer these facilities and say, until your vaccine gets approved, you will make the vaccine that is first in line, which was Covishield. And we could have had that capacity in January, February, March. It would have been twice what we have now. But having said that, the math suggests that we have about 90 million doses in stock. So there's some math done by a few researchers to say we have about 90 million doses in stock. We're producing about 65 million or so or thereabouts every month. So we should have a huge capacity. So it doesn't seem like production is the problem. It seems like distribution is the problem. Now, whether the government is unable to go out and have a discussion with Serum Institute and say, guys, you've got 90 million in stock, give it to us now. That is the question that we should be asking. It is sitting somewhere, but the government's not able to lay its hands on it, and it's not reaching the people. That really is the question. It's not about capacity. That's not a practical solution today. Too late.
Too late, you say. But for some reason, Maharashtra has been saying it for a while. The center doesn't seem to be responding to it. But Maharashtra has been saying, allow us to, and allow our institution, HAFKIN, to collaborate and manufacture more of these vaccines. Dr. Lahane, what is that proposal? And even if now the center says, okay, can we quickly do it? How quickly can we ramp it up?
Yes, because our Honorable CM Sir has already visited the HAFKIN and our experts have also visited the HAFKIN. And HAFKIN has a capacity to produce the vaccines because HAFKIN is producing the polio vaccine. And also we have got everything ready. Once they give us a formula and the material, then we can start this one within 3 months. We can I can produce near about 2.5 crore doses. So we are requesting the center that the formula, which is I think Bharat Biotech formula, if they give it to us and permit us for the production in the HAFKIN, I think HAFKIN will be definitely help in the production of the this vaccine.
But from say the date of approval, how long would it take for HAFKIN to put out the first batch of doses, Dr. Lahane? And I ask you
3
this
months.
since you are on the board of HAFKIN as well.
Yes, because the once we get this approval, after that within 3 months we will be able to produce the first batch of the this one vaccine.
Okay. Okay, so even if we move on it now, it will take us, Vikas, at least 3 months to produce the first batch from Hafkin. And 3 months is a lot of time when we are hoping to, battle this second wave. What could be our other options? Do we then look at some of the vaccines which are there available elsewhere in the world and, giving them approval on a fast-track basis?
Yeah, that's a very good point you raised, Tanvi. Basically, see, I'll tell you, basically what has happened is no one predicted, it was almost seen as a problem of the past. And then suddenly things changed so badly that, now we are back to the same situation or probably even worse. So what had happened in the interim, we thought that, things are all going to be normal and companies entered the COVAX agreement, which was a firm commitment from India that it will be able to help and supply vaccines to a clutch of some 90 plus countries. The same Serum Institute and Bharat Biotech also entered into bilateral agreements with a host of countries. There also the supplies had also started. Remember the Brazil supplies and then the controversy of Iran actually challenging Bharat Biotech and even AstraZeneca talking about a legal notice to Serum Institute. All of this happened in a situation where everyone thought that it's going to be all fine and there wouldn't be a surge. So we opened up supplies. Also, there was a political, angle to all of this because China was actually increasing its influence and supplying its vaccines to a host of its allies. So all of this actually befuddled and confused the supply situation within the country. And, as we started talking about, vaccine efficacy, the immunogenicity data, the confidence in the vaccines also started going up. So that's again a situation. Now comes about the issue of regulatory approvals. I mean, I fail to understand what it takes for the regulators to really clear up the vagueness about Sputnik vaccines. Is it about the price that they are stuck? Why are we not having any idea about the Johnson and Johnson's vaccine, which is a single shot vaccine? And so they had said that at cost they will be actually having it at a USD 10 per dose. So this is probably a time to really think very differently, not to get stuck with prices. Whoever can afford a set price should be allowed in the market, provided all the safety and efficacy parameters are met. I think that's where with the approval coming for the first two vaccines, we were really fast, agile. But with the second wave of vaccines, I think we've really been extremely slow. So that probably will solve a lot of our issues. And of course, as Murli also mentioned about the agreements and whether it can be outsourced. We knew about the licensure that actually happened from AstraZeneca to Serum Institute way back in the middle of last year, probably March or April only. So those things, somewhere they went in some cold store and nothing after that was heard. So I think that requires to be accelerated. And as Dr. Lahane said, even if we start today, it is going to take 3 months. I mean, for all the validation, the batches go to Kasauli, then it gets through all the approval processes. Do we have that much of time is the question.
Okay, do we have that much of the time? Well, we can only begin to address that question once the governments agree we have a problem. And if they continue to say there is no shortage, then I don't know at what point will we begin to address this. You raised a very interesting point, Vikas, which is to say that Serum struck its contract with AstraZeneca a while ago. Their obligations for the world over would have been struck at that time. Mr. Rajib Dasgupta, does it look like a situation where because we wanted to get a better price and we waited for our turn to negotiate and get that price, we allowed the vaccine makers to get into several other obligations and contracts, thereby losing the edge on having the first say on these doses?
Well, when all this conversation began several months ago, at that time the understanding was that as many as 6 vaccines were actually on the pipeline through various collaborations, including 2 indigenous ones. the Bharat Biotech and the DBT and another DBT-funded vaccine. Now, unfortunately, the other four have still not really taken off, the starting mark. Also, Johnson & Johnson has now been granted the permission to conduct the trials. Now, under the laws, an accelerated trial or a bridge trial will have to be conducted on the Indian population. So that's something which has got to be factored in, plus the production time. The point really about exporting is, one, as was explained, is the COVAX agreement commitment, which supplies 92 countries which are either lacking in the capacity to produce or capacity to buy. That, as a member state and as a key vaccine producing state, India certainly has a commitment. It is the other vaccine Maitri component which really is, if I may, the discretionary part of it. And that's something which is sort of open to debate. The COVAX commitment is perhaps not so much open to debate. Anyway, now having committed to this vaccine Maitri, that's again a committed amount, plus the export amount that Serum Institute is exporting to various countries, including UK, which has now covered nearly 60% of the population. Also, the fact that at that point, the understanding was that there are 6 vaccines in the pipeline, but we really didn't pre-book for whatever mix of reasons, which is now showing up. And therefore, I repeat, as was explained, that Hafkin can start producing in 3 months and so on. But it is really the next 3 months that's going to be critical. And both state and central governments will have to do some nimble-footed operational changes and tactical changes to tide over this period. After the 3 months, there's a lot that's happening. It's like a lot of films lined up for the Diwali release. It's just like that. There are vaccines in the pipeline. There could be direct imports and so on and so forth. But it's really the next 8 or 10 or 12 weeks that's going to be so critical, and the world is going to watch it.
Fair enough. And in these 3 months, we need to figure out what our strategy will be now. We need to figure it out today. I mean, it's really, really scary to see visuals of shut vaccine centers, people queuing up outside for their second jab or even for their first jab and being told, go back and we don't know when you can come. That's something that I think, politics aside, the governments need to figure. But here is the other aspect then, and Murli, maybe you can come in on this. The government's vaccine diplomacy or vaccine Maitri has effectively just, sent out 1 crore doses. The large part of it actually comes from Serum's own commercial agreements and also under COVAX, both of which probably we couldn't have done much about, or could we have? Could we have done about Serum's own agreements the way we seem to be telling them now to not export at all?
Of course we could. And all of the players, the other countries who are part of the COVAX agreement, the commitments that we made are all subject to us having enough for ourselves. So saying that, oh my God, if we don't export 60 million doses, which is the number that we've been told by the government has been exported, we'll be in deep trouble, is not entirely true. Every government in the world understands that we need to deal with our people first, and we have a real crisis in this country. Nobody can doubt that. So I doubt that if it would have been a huge challenge for Indian diplomats to have to explain to the rest of the world that, listen, we've got to slow it down. We can't give you 60 million in one big go. We'll give you a little bit every month while we use it for our own people. So I don't think that's an issue. Secondly, on the commercial commitments, there was a very clear understanding that even in commercial agreements, irrespective of whether it's a vaccine, irrespective of whether it's a pandemic, the law on it is that if the country, which is the government in this country of India, doesn't allow you to export, then you're not on the hook for damages, for any liability. That's a well-established principle throughout the world. So there is no big scare that if we didn't export,
so the notice that AstraZeneca
billions.
has sent Serum Institute right now for not meeting their obligations won't hold valid because the central government has told them to not export?
Correct.
Okay.
And that's a perfectly reasonable defense. It's been taken for almost 100 years from before the First World War, when there were restrictions on export of certain goods. So it's a well-established principle that it's impossible for a company to do anything if the government stops you from doing it. That's not a breach of contract.
Okay, fair enough. Now, in the last part of this conversation, let's talk about what else can be done. Dr. Lahane, especially in the state of Maharashtra, where now, whether we used our 1 crore doses rightly or wrongly, those doses are done. Now we are waiting for the government to give us the next set. What are our other options? If the government says you're only going to get 17 lakh for the next 1 week, then do we just have to live with that and slow down our vaccination process?
See, first of all, it was only given 7 lakh doses. Later on, Honorable CM Sir intervened, and then now they have given us 17 lakh doses. But if you see, we are now administrating there about 3.5 to 4 lakh doses every day. And I think this 17 lakhs per week is it is a very much less dose for Maharashtra. And as you know, the 60% cases of the COVID are from Maharashtra. So we require to fasten the vaccination in Maharashtra. And for that, we require more doses. Now, see, as it is dependent on the government of India, so Maharashtra can't do anything. We'll have to now, we are already slowed down the Covaxin we are not giving. We are giving only for the second dose. The co-shield in few centers, maybe more than 40 centers, we are not giving co-shield also. So I think we have to now slow down in all centers and go for, also we'll have to now distance the co-shield what we are giving in 6 weeks. Now we can ask them to wait for 4 weeks. For the 8 weeks for the second dose. So I think, and then we will administer first dose. So that strategy we will have to do in Maharashtra, so that we can go for the more number of the...
Dr. Lahane, do you see a need to suspend fresh vaccinations for some time? Is there a fear that we will not have enough even for the second dose for others? Or if you expand the time from 4 weeks to 8 weeks, that can be managed?
I think we are calculating for that co-shield doses. In that we are trying to manage the second dose after 2 months, but within 1 or 2 weeks, if the vaccine is not provided to us, then we will have to stop new cases, new job, and we'll have to go for only the second doses, because second dose we'll have to give before 2 months, and also for the Covaxin in 4th week. So again, we'll have to stop the new vaccination program.
That is a real possibility. That is a possibility that some of the states may need to look at, and I'm sure the current distribution system where you're getting your doses on a weekly basis, on a weekly negotiation that you have to do with the central government, that we want 7 lakh, no 10 lakh, no 17 lakh, is not going to help you plan better in any sense. Because one aspect that was touched upon here was obviously availability of doses, and serum being the large one. The 90% doses are coming in from Serum Institute. What is going on with Bharat Biotech? Is there any information there as to when they will be able to ramp up and provide a larger chunk to people in India?
Yeah, so from what we understand, they are actually looking at a capacity expansion at 2 of their sites in Hyderabad and one in Bangalore. And the signals that we are getting is also if it can be outsourced to a couple of other units. As I also mentioned, given its limitations of producing in any facility, that probably is not so easy, because the Sputnik vaccine thing, the salient part of it is that most of the contracts that they have actually signed are actually with non-vaccine producers. So it's not as easily adaptable to in the case of Bharat Biotech's vaccine. Secondly, since you also asked Tanvi about what else can be done, I think whenever there is a crisis, the issue is about addressing the root cause. Now, the points that have been made by Serum Institutes, Adar Poonawalla, is also about a shortage of reagents and raw materials. And if that is something that can pose a situation of more crisis, is that being addressed? there is also uncertainty about the pricing. We don't know whether Sputnik is actually stuck because there is a disagreement on pricing, or is it because of some other issues. So if they are actually hell-bent on saying that, okay, they cannot go beyond USD 10 per shot, is that where the government is stuck? So releasing this kind of a huge abundance of quantity can probably be one of the quick fixes. When I say quick fixes, it probably means still several weeks.
Months, yeah.
At least we would have some vision, some sight on the problem solving. So these are also some of the issues which we need to prioritize really.
So Sputnik is one, of course, we need to look at, and the government needs to tell us what's going on as far as that approval is concerned and why exactly is it stuck. Second, of course, is the hope that Bharat Biotech is able to ramp it up quickly. But because from my conversations here with all of you, the sense that I am getting is that the pharmaceutical hub of the world, the one that said this is going to give us the edge and we will be the ones giving vaccines to everybody, somehow got its own policy wrong, and our makers have ended up signing contracts with the whole world except for enough doses with us.
Yes, absolutely. There was an article in Guardian which I wrote, which I read, was about the same thing of how 90% of the world supplies of vaccines probably depends on one vaccine supplier. So I think that kind of puts the entire perspective on how skewed is the dependence of the world on one country, and it's tough to see this struggle for the domestic demand to be met. So hopefully we'll be able to find some solution to that.
Hopefully we'll be able to find some solution to it, and we're able to vaccinate more and more people. In fact, interestingly, one thing that Dr. Lahane pointed out here, and I wanted to add to that, is changing the gap interval between the two doses for Covishield. Now we know that when Covishield applied for it, when Serum Institute applied for approval, they said that the ideal gap is 4 weeks, and so the government approved that. Soon after, we saw in Europe, in countries like UK as well, AstraZeneca saying that we've found more data and research that shows it works better if you give a gap of 8 to 12 weeks. That's 2 to 3 months of gap between your first dose and the second dose. UK has implemented that, and so have many other countries who are actually using the same vaccine. When we had asked the central government at that point of time, several weeks ago in our country, if we are going to change our interval from 4 weeks to 8 to 12, while they said, yes, it is better if you wait longer, but the minimum still remains 4 weeks, because that's what the applicant told us, that's what the vaccine makers told us, and if they say that's the appropriate amount of time, we're going to go ahead with it. Serum Institute itself is now advocating 8 weeks to 12 weeks. It just goes on to show you that there is a larger understanding of the fact that we don't have enough doses. And enough doses can now not be manufactured overnight by nobody. It's impossible. There may have been a few wrong decisions that we've made along the way as far as our vaccine policy is concerned, but now we've reached the point. We've reached a point where we don't have enough to feed the current demand, and we may have to slow it down. Doesn't look like there is any other option. And one of the decisions that may then happen is the government saying, okay, everybody now waits 8 weeks to 12 weeks to get their second jab. We don't know. We'll have to wait to hear from the centre in the coming days. Thank you to all of our panelists for joining us on conversation number 2.